And now, ladies and gentlemen, I'd like to introduce the next session, which is the flagship session for the evening, and that is Dr. Randeep Guleria in conversation with Sri Subroto Bagchi. I'll request the AVs to please be played.
पद्मश्री डाक्टर रणदीप गुलेरिया देशर जणे सुनामधन्य पल्मोलोजिस्ट दिल्ली एम्स पूर्वतन निर्देशक कोरोना समय जहांक मुहरु पदे कथा सुनिबाकू अपेक्षा करि रहुथिले देशवासी कोरोना नियम पालन पई परामर्श हेउ कि चिकित्सा व्यवस्था संपर्क में डाक्टर गुलेरियांक ठारू जानिबा परे लोके आश्वस्त हेउथिले देशर कोविड मुकाबिला रे रहिछि तांकर गुरुत्वपूर्ण भूमिका कोरोना महामारी मुकाबिला संपर्क में लिखित पुस्तक टिल वी विन रसे हेउछंती को-ऑथर जनरल मेडिसिन रे एमडी और पल्मोनारी मेडिसिन रे डीएम करिबा परे एम्स रे जोग देइथिले डाक्टर रणदीप गुलेरिया पल्मोलोजी विभाग मुख्य हेबा सह दिल्ली एम्स रो निर्देशक दायित्व तुलाइथिले पूर्वतन प्रधानमंत्री अटल बिहारी वाजपेयी व्यक्तिगत डाक्तर भावरे से कार्य करथिले फुसफुस संबंधी रोग संपर्क में से अनेक संदर्भ लिखिछंती जहाँ देश विदेश रे उच्च प्रशंसित होइछि चिकित्सा विज्ञान रे तांकर उल्लेखनीय अवदान जोगु 2015 मसीह रे तांकु पद्मश्री सम्मान रे सम्मानित करा जायथिला 2014 रे तांकु मिलिथिला मर्यादाजनक डॉक्टर बीसी रॉय जातीय पुरस्कार पद्मश्री डाक्टर रणदीप गुलेरिया को स्वास्थ्य संवाद और कनक न्यूज रो हेल्थ कॉन्क्लेव को शुभेच्छा और अभिनंदन। सुब्रत बागची केवल ओडिशा रे नुहे देश विदेश रे मध्य एक परिचित ना माइंड ट्री रो सह प्रतिष्ठाता ओडिशा स्किल डेवलपमेंट अथॉरिटी रो अध्यक्ष जणे जनाशुना उद्योगी भावरे से जेतिकी जनाशुना जणे समाजसेवी भावरे तांकर रहिछि सेतिकी ख्याति जनहितकर कार्य पई तांकर आग्रह सबुबेले देखिबाकू मिलिथाय भुवनेश्वर रो कैंसर हॉस्पिटल और पैलिएटिव केयर पई सुब्रत बागची और तांका पत्नी सुस्मिता बागची 340 कोटी टंका दान करी अन्य मानक पई उदाहरण सृष्टि करिसंते कोरोना महामारी को नहीं जेतेबेले सारा राज्य रे आतंक खेली जाइतिला सेतेबेले कोरोना स्थिति नहीं सरकार को पक्षरु टेक्निक तथ्य गणमाध्यम रे रखुथिले सुब्रत बागची कोरोना मुखपात्र भाबरे सरकार सचेतन वार्ता विश्व महामारी संपर्क रे तांकर वर्णना ओडिशावासींक मन को छुई पारिथिला कोरोना मुकाबिला पई मुख्यमंत्री रिलीफ फंड को 10 कोटी टंका दान करी चर्चा रे रहिथिले सुब्रत बागची श्रीजुक्त सुब्रत बागची को स्वास्थ्य संवाद और कनक न्यूज रो हेल्थ कॉन्क्लेव को शुभेच्छा और अभिनंदन।
Ladies and gentlemen, we are extremely honored to have with us today Padma Shri Dr. Randeep Guleria, a revered Indian pulmonologist and the ex-director of All India Institute of Medical Sciences, New Delhi, in conversation with Sri Subroto Bagchi, co-founder Mindtree and chairman Odisha Skill Development Authority, was appointed as the spokesperson of the Odisha government during the pandemic. I request all of you to kindly put your hands together once again as we welcome both the stalwarts on the stage. Thank you.
So good evening, Dr. Guleria, and you are a pulmonologist. So on behalf of Odisha, Odisha government, the Sambad group, and everybody here, welcome once again. And I would like to ask you, how's the air quality in Bhubaneswar compared to where you come from?
Thank you very much, and I'd like to really start by thanking the organizers, the Sambad group, Connect News, for inviting me over. It's really a pleasure to be here in this health conclave. You're right, it's nice to be out from Delhi because Delhi, not only is it cold.
In one way or many ways?
In many ways, because the weather there is, it's a little bit chilly there, and the air quality is not as good as it is in Bhubaneswar.
Yeah, I think the traffic is also much better here.
Traffic is much better, the roads are very nice, and so it's a pleasure driving around rather than getting stuck in traffic jams.
So, Doctor, actually we have limited time, and I wish that we had a couple of hours with you, but we have to compress in about 30 minutes, so which makes me feel that we should straight delve into Dr. Guleria, the person, before we talk about anything else. Now, you studied in St. Columbus. So imagine the young boy who is about to graduate from St. Columbus, getting into a medical school, and Dr. Randeep Guleria, to whom the whole country looks up. So if you were to look back at who you are today, did you imagine that you will be where you are with the kind of adulation that you get today, COVID or not, COVID or no COVID? Did you imagine that you will be where you are today? You come from a middle class family.
Correct. So I've not imagined that at all. As a matter of fact, I wasn't even sure whether I was going to take up medicine or not. I was thinking of either taking up medicine or joining the armed forces. A lot of my relatives are from the armed forces, and it's a different lifestyle. So that was what I was thinking of, joining the army. And I come from a state of Himachal Pradesh where a lot of people join the army. It's considered to be something that they do out there. But decided to become a doctor. My father is also a doctor, so that influenced me more than from my mother's side, where all my mother's brothers are in the army. So it was a decision to.
So you're fighting a certain kind of war, and clearly during COVID you fought a huge war yourself. So I think there's convergence. What the audiovisual did not say, and I'm sure many people in the audience do not know, is that if you look at per capita number of Padma Shris in a family, his family is probably going to be right at the top, because his father got Padma Shri, his brother got Padma Shri, and he is a Padma Shri. So here's my question.
You missed one person. My father-in-law is also Padma Shri.
Oh my God, father-in-law is very important. Please convey my apologies. Yeah.
But he not for medicine.
Well, it doesn't matter.
Yeah,
It's still a Padma Shri.
Since we had the hockey tournament here, my father-in-law is a Padma Shri because he was the captain of the Indian hockey team, which won the Olympic gold medal.
What a lovely coincidence. So, what goes into the pathology of Dr. Randeep Guleria? What is he? What made you to be who you are? What is the secret of your success? How will a young medico today getting into the profession become who you are today? So, what is I won't say the secret of your success, but what are some of the defining things that you think have made you who you are today?
So I think the most important thing is that medicine is a passion, it's a calling. You have to take up medicine if you're really into it. It's like no other profession that I can think of. There are no fixed hours. You deal with patients throughout your life, see their suffering, but you really get maximum happiness that you get is when you see a patient who's become all right and smile and say thank you to you. That type of satisfaction, I don't think is given or you can get in any other profession.
But it's also, extremely high. It requires a certain sense of vision, certain sense of inner calling, certain sense of leaving the clutter aside, because a lot of people in the medical profession, I'm not being judgmental here, but they get torn between choices, So the typical choice of spending your entire life in a place like All India Institute of Medical Science or SCB Medical College here, being in public practice as against private practice, the glitter, the glamour of money and everything else. So how did you actually stay away from it? What made you, and were there regrets as you went along, were there peer pressure? How did you deal with the societal issues? You have long hours, difficult situations. In a place like All India Institute of Medical Science, you have to deal with the politicians before you deal with patients. You have to deal with the bureaucrats before you can deal with medicine. So balancing multiple different, very, very difficult stakeholders, and then the long hours, and then you make sacrifices on the family side. So how do you deal with all this?
So it's a challenge.
It's not easy, right?
It's not easy. You have to give up a lot of your family time. I do agree with that. At the same time, I think if you like what you're doing, then it's like a hobby. You don't really mind spending more and more time doing what you enjoy doing. If you like teaching, you could teach your students for hours and not really realize that, time is flown by. I would take extra classes for my PG students, and sometimes I would start at 6 in the evening and I won't even realize it's 9 o'clock till I start getting calls from home that I'm not coming home for dinner. So those are the type of things that you enjoy. And if you enjoy all of that, then other things don't matter. So it's the glitter, the money doesn't really matter, because you can spend all your time just doing this and be very happy. And I think you live in a very close bubble and a very protected world, which itself is also very, very good.
So it is a sense of purpose. So you're basically talking about building a sense of purpose, and that becomes the
Correct.
determinant factor in terms of what you give and what you get. So, Doctor, here it is. We'll switch to COVID for a moment because, as the audiovisual was again saying, that you were the face of assurance for the country during the difficult days. Let me ask you this. Were there moments when you felt afraid?
Definitely, I think we were dealing with the unknown, and especially in the early days, not only doctors, all health professionals, the general public, all of us were scared because we didn't know how the virus would interact with the host, that is humans. The severity of illness, the transmission, would we carry the infection to our homes and give it to, let's say, our children or our parents or grandparents? All that fear was there, and I remember the first few days when we were setting up the COVID ward, many people said that, you're wasting your time, nothing is going to happen. And then we had the first few cases, and there were a staff nurse who refused to go home because she had just crossed a suspect COVID patient. She had not even touched the patient, but she felt that now her whole body had been infected with the virus, and she would go home and give it to her parents. So that was the type of fear that we had. I had to deal with another fear at home because my wife is also a doctor. She was also working in a different COVID hospital. My son was working in another COVID hospital. My daughter-in-law, she's also a doctor. So all four of us were sleeping in different rooms and having dinner separately because we were worried that if one of us got the infection, we would give it to the others. So it was a tough time both from the family point of view, and there was definitely an element of uncertainty.
But you clearly had this determination that we'll win the war, and that is the theme of the book that you wrote. Very interestingly, in the book, you have given huge amount of credit to the frontline warriors. Now that brings me to two questions. One is I would like you to elaborate on that as to what significant contribution the frontline warriors actually made. But more importantly, and here it is a little bit of controversial issue, in this country, doctors tend to be overrated at the expense of all the other people that make up the medical system. So I'd like you to reflect first on the contribution of the frontline warriors, and second, please help us to decode this social obsession of equating the healthcare system with doctors and great doctors.
So I think everyone played a huge role as far as COVID was concerned. I think all of us, the entire population, to some extent played a role. And I would say everyone was a COVID warrior. But the frontline workers, whether it be healthcare workers, ASHA workers, people who were working at the ground level, I'm not talking of the hospital, but doing the testing, doing the screening, the police officers working in the containment zone and containment areas, all of them were equally exposed. And they had less knowledge about the virus. They were not really taking all those precautions in terms of PPEs and other things. And that is why I think they were and did play a huge role as far as managing the pandemic was concerned. Regarding your second question, yes, I personally feel that it's not only that other healthcare workers are not given the importance, it's a big loss for us because I feel that if we are able to get them into the folds, the health system can do much better if we have practicing nurses, nurse practitioners for that matter, who could prescribe medicines in areas where you don't have doctors. We have teleconsultation now. They could consult a physician and then be used as nurse practitioners. We could use the other allied services in various areas. The healthcare system could be used in a more efficient manner than relying only on doctors and using others for work which is now not that important. It may have been important, but technology has come in a big way. And that has really changed the whole perspective as far as healthcare is concerned.
So, Doctor, we'll switch for a moment to a very important aspect as far as the medical profession is concerned. You started by talking about the medical profession being a calling. It's an inner call. It can't just be a way to make money. Yet, if you look at the medical profession today, there's a lot of conversation about ethics and integrity. And, people taking shortcuts, people actually putting money much ahead of everything else. My take on that would be that it is a difficult question to discuss and consider. Leave aside the issue of capitalism and greed and everything else, but leaving that aside for a moment, if we look at integrity, it is an increasing challenge in the medical community, and it impacts millions of people. What is your take on that? What would you, if I were a young medico today sitting with you on this platform and said, Doctor, tell me about your views on integrity in the, not just for the doctors, but the entire medical world, what would that be?
So I think overall, and this is not only for medicine, but in general, values have changed. When we were young, we had a society which was more value-based, and medicine was a service that was looked at. We valued teachers more than we valued people who were in business. We valued people who were academicians more than we valued people who were making big amount of money. It didn't matter how big a car you had. It mattered if you were a professor or not. And if you were a good teacher or if you were a good doctor, you got a lot of respect, irrespective of the fact that you may not be very wealthy. All of that has changed in one generation. And from a service sector, it has become more and more of a business sector. And because of that, the science of medicine and the art of medicine have sort of lost their way. And I think that is what we need to bring back, even for the young generation. Medicine is both a calling, it's a science and an art. And the art of medicine is how do you empathize with your patient? How do you maintain your ethics? How do you make sure that when you talk to your patient, the patient feels that you're actually there to look after him as in totality, rather than just not looking at him from the disease point of view. It's very important to look at a patient as a person, as a human being, with all his other issues which also need to be addressed. That's what a real doctor is about, curing a patient not only of his disease, but making healthy as an individual.
That must be the theme of your next book, and I think it is a crying need of the hour, because somebody told me one of the biggest tax defaulters in the country are lawyers and doctors. Which is not nice. It's not something that to just laugh about. But I think it is a profession where the integrity of that profession is critical to society as a whole. So, Doctor, actually, you alluded to medicine being science and art, and we'll talk about science for a while. There's a lot of conversation about ChatGPT, and certainly with ChatGPT clearing medical tests and engineering tests and so on, the whole conversation about artificial intelligence has become center stage. What is your take on the role of artificial intelligence and what it will do to the world of medicine?
So I think artificial intelligence will change medicine to a large extent. We are living through what is known as the fourth industrial revolution, seeing changes in healthcare occurring like we've never imagined before. I mean, the changes that I saw we've seen during our lifetime, we thought those were great. I mean, when I was in medical school, I would have to go to the post office and book a trunk call to talk to my parents and wait there for 2-3 hours and then, have this very bad connection. And then we had STD which came up, and we were very happy that now you can make a straight trunk dial and you can directly talk. Today's generation couldn't imagine that you had such a situation in your lifetime.
Yeah, we could never imagine doing video conference, at the, forget about video conference, to have a video calling was unimaginable when we were growing up.
So the change has actually become even faster now. AI, 3D printing, big data analysis, wearable devices. People can monitor their ECG using their wearable devices and know whether they're having an arrhythmia or not. All of this will become part of healthcare. AI will help doctors, I think, in 3 or 4 areas, radiology for that matter. There's already a program which the government is trying to see, can we use an AI-based technology where doctors or even others at a rural area can take a picture of an X-ray, it could be a chest X-ray, it could be an X-ray of a bone, and AI could help them diagnose what the disease is or whether it's a fracture or not. A picture of a skin lesion. AI could help you tell what is the skin problem that you have and what could be the likely treatment that is available. So it could complement what doctors are doing. It's for pathology also. A slide could be looked at better if it was associated with AI support in terms of picking up abnormal cells. So I think it will change the way medicine is practiced as far as technology is concerned. One of the things that we saw was
But
telemedicine.
do we risk losing empathy in the process?
Yes, so that is what I'm trying to hint at, that medicine still is a science and art. And would you say that since science has progressed, art is not important today? I think it's even more important today, because although science has progressed a lot and we are having AI and all of this coming in, the person will go to a doctor who empathizes with him, who understands his problem, and who really wants the patient to be all right. And that's why even if you have your computer-based diagnosis, an individual will be happy only to talk to another individual who empathizes with you.
A human being to a human being.
Correct. And the art of medicine is
So
important.
on that point, doctor, there are a lot of people, a lot of doctors actually in the medical profession who think they're God and they play God. On the other hand, great doctors like you actually see God in the patient. So I want to ask you, you're a great doctor, you're nationally respected, internationally respected. Tell us some of your patient moments that actually changed you as a human being. So in your entire life, there have been probably millions of patients who you have touched. So what are those one or two patient moments where the patient actually changed you?
So I think all of us as physicians have had a lot of interaction with patients, and you realize that this maximum satisfaction that you get is not with the rich patient,
Tell us a
but
story.
with the poor
Tell
patient.
us one or two stories.
So I'll give you 2 or 3 stories where I'll try and highlight even what I said, the importance of the art and the science of medicine, but also the fact that you will have patients who come. I used to sit in the OPD from early in the morning and till late in the evening. I mean, I used to sit at around 8:39 and sometimes get up only at 7 in the evening. And it used to be very crowded, and I used to feel so sad that there are patients who would come and tell me, I came at the time that you entered the OPD, and now at 4 o'clock my turn is coming. So I've been sitting outside also. And I would say that, why didn't you go and eat something? He said, no, I thought maybe someone would call my name and I would go in. So that type of the dedication, or I would say the involvement that patients had, makes you feel even more humble that, if you have a patient who's willing to wait so much to see you just for a few minutes, then you really have to give your best to be able to provide care to them.
But no, tell me a story of that one patient that brought tears to your eyes.
And then these patients, for example, some of them come from a very poor background, and they would, bring you some gift which you would feel so touched with. One patient bought me a pair of socks. Yeah. Or someone said, I bought this jaggery from my village because I thought you may like it. So those are the type of things. I mean, I knew that they would have thought about it, and it's not that they could afford a lot of such stuff. So it's that type of things that make you really feel that this is the reason why you are in this profession. Coming to the story, talking of writing books, I was thinking of writing a book on the role of clinical medicine in this era of investigative medicine. What has changed medicine dramatically from what we used to do or what was done in the past is that medicine was a clinical part. You examined the patient, you made a diagnosis, and you gave a treatment. Now you don't examine the patient that much, you write a bunch of investigations, and then you treat the patient. The bunch of investigations help you get a better diagnosis. At the same time, they have increased the cost of healthcare, and that is what has driven the entire process of medicine becoming more expensive. But if you rely too much on investigative medicine and don't use your clinical sense, you can have a major problem. I'll give you a story. And this is a lady whom I saw. She had a lump in her breast, and it was operated and removed by my brother, who diagnosed as breast cancer, but she was all right. She had a follow-up PET scan done about 6 to 8 weeks later. And at the radiology department where she had it done, the radiologist told her that the scan is showing uptake in different parts of your body, and you are now have stage 4 cancer. You just have a few weeks to live. And I think you should now start seeing how you can settle things in your life. She went into severe depression. She went and met my brother. And he asked me, can you have a look at her? Because I was pretty sure that I had removed it, but it's possible that the tumor may have come back. So when she came to me, I looked at the PET scan. The PET scan showed lesions in the lung, in the upper part of the lung. It showed lesions in the glands. It showed lesions in what is known as the ileocecal junction, where the small intestine meets the large intestines. Now, if you look at it, all of these are areas where you see tuberculosis. You don't see breast cancer. And so I told her, I don't think you have metastatic breast cancer. I think you have reactivation of tuberculosis. And I would actually advise you to start TB medicines, and you should be all right.
Unbelievable.
And she told me that for 1 month she had not slept.
Yes.
She went
I can
into
imagine
severe
that.
depression. She was arranging the marriage of her daughter.
It's like somebody has given you the death warrant.
And then subsequently she went to Bombay, and then an FNAC was done. It showed TB. She comes every year to meet me on Diwali, and she tells...
What a nice story. What a nice story. Beautiful, beautiful. So, Doctor, with the limited time that we have, I'll probably take a couple of more questions. How are you doing on time, Tanaya? Anybody can tell us how we are doing on time? Who's timekeeping here? Okay, so we can go on. Nobody is telling us to. We have 2 minutes, 5 minutes, 10 minutes, all night. Okay, so Doctor, Odisha has been a very committed state in terms of healthcare, health for all, under the vision of the Honorable Chief Minister Shri Naveen Patnaik. We'll be completing 100 years as a state in 2036, which is not far away, with just about 13 years more, so let's say a decade. If you were the chief advisor to the Honorable Chief Minister of Odisha, and you say, look at a blueprint for the next 10 years, what would be some of the significant things that you would suggest that a state like ours should be focused on?
So I think one of the most important things is to see how we can bring technology into medicine so we provide high quality healthcare to everyone, irrespective of whether it's urban, rural, or remote areas. Secondly, I think universal healthcare is something that we must strive for. It's something that is, I think, a basic right for all human beings, that health for all, irrespective of your socioeconomic status or your affordability, should be something which is of prime importance. And we should develop strategies where, in my opinion, the focus of healthcare is shifting more and towards non-communicable diseases. And therefore, there has to be a focus on preventive health. We must focus more on preventive health rather than curative health.
So we are told that, you spoke about non-communicable disease. We are told that India today has become the capital, world capital for NCDs. Okay? So you talk about diabetes, we are number one. Talk about cancer, we are the cancer capital of the world. We are actually up there. Now, given the pandemic nature, of course, when COVID happens, everybody wakes up. But today, if you look at the totality of maybe 5 major NCDs, it is something of a pandemic size of a problem, which we talk about taking an all-government approach, but we are far away from figuring it out as a country. So as somebody who's been in policy and whose voice has been heard at the central government level, which are some of the things that you think the government is trivializing? The government should actually take it far more seriously than it is taking.
So it's a difficult question because of the fact that health continues to be a state
subject. You are
subject.
no longer in names, doctor, please.
So I think there has to be more investment in health, to be very frank about it. I think we need to put in more money in healthcare. We are not doing that. We need to look at more of public
Give
health.
us a sense on that, because people understand per capita, investment in health. So how does India compare, just for the benefit of the audience here, vis-a-vis, let's say, other countries, some developed and some not so developed countries?
So even if you look at our neighboring countries, or when you look at the developed world, our per capita investment in health is way below what it should be. And we need to focus more. We focus more on so-called roti kapda makan. I think importance is health, and the pandemic showed this, that unless you have a healthy nation, all other systems that you have in your country also suffer because of that. So focus has to be on health, and there you have to have put
So
some
the key indicator there is the amount of money you are spending on health as a nation. So that is
That is one.
That you think we are underinvested as a country.
So it's not it's not given as much priority as it should, and focus should be, like I said, on looking at preventive health, primary health, universal health coverage for all. I was part of a committee which made some recommendation for the 15th Finance Commission, which took up health as a special subject, and we actually said that we must invest more in healthcare, both in providing infrastructure, then in human resources, so that you have enough people, and that is not only doctors, but healthcare workers, nurses, ASHA workers, enough infrastructure available even at rural areas, at a district level, to provide quality care. Those type of investments are not happening, and that I think is what we need to do. And then, like I said, focus a lot on preventive
one point
health.
you talked about is not being underinvested in healthcare. And secondly, you're talking about the last mile, taking it to the last person standing in the universal healthcare coverage. What would be one or two other quick things before we take the last question for the evening?
So I think we need to also work on how we can get technology into healthcare in a big way. I think COVID showed us the way. We had eICUs, we could monitor patients while they were at home. Both the patients, so you could monitor your diabetic and hypertensive patients at home because they were scared to come to the hospital. And during the pandemic, you could do home isolation. You could
What about human capital development?
So human capital development is, like I said, very, very important. We need to invest more in that. And I think there has to be government investment in that. We haven't really, we have moved more towards private investment.
Yeah, we think outsource, take my mess for less and the problem will solve itself.
Correct. So we need to really...
Government cannot let that go.
So
it's responsibility
two
for health.
that the government cannot let go, which I feel is health and education.
Okay, so that takes to the final question that we have with the limited time, and I wish we had more time. So we go back to Randeep Guleria, who's not yet a doctor. St. Columbus, you're coming out, boy from Himachal Pradesh, idealism in the eye, little confused between, whether we'll go to NDA or go to medical school. And suddenly on your hand, you have an offer from Stanford, one from Harvard, one from Yale Medical School, and one from All India Institute of Medical Science. Where will you go and why?
So now it's going to be a little bit of, because of what I know, I would definitely go to the All India Institute of Medical Sciences, New Delhi. The reason for that I can give to you also. The type of training that doctors get in India is far superior to the type of trainings you get anywhere in the world. The patients that you see here and the type of passion that you have in your teachers in terms of making you learn is unmatched. And now that I've been at AIIMS, I've had people come from Harvard on elective postings. And I still remember many years ago, this is about 2 decades ago, a young girl who came and she spent 2 weeks in the emergency and 2 in the medicine ward. And she said, I'll never see such patients in my life. And how do you manage to see such a large number of patients in your emergency and in the OPD? It was an eye-opener for her. She used to go back in the night and examine some patients because she said, I've never seen such a large spleen. And she'd keep palpating it because she felt that you'd never be able to see it again in her life. So those are the type of cases and the experience that you get, which actually makes you a better doctor for the future.
So thank you very much, Dr. Randeep Guleria. I think he deserves a big hand. And once again, welcome to our beautiful state. And
thank you.
We hope to host you again in the near future sometime. So thank you, Doctor.
Thank you. It's my pleasure. Thank you.
Thank you so much, Dr. Randeep Guleria and Shri Bagchi. I'll now request and invite Shri Soumyaranjan Patnaik, Chairman, Sambad Group, to kindly join us on the stage and felicitate both stalwarts we have with us on the stage. I shall now request Mr. Himanshu Raut from EVOS Buildcon to please join us on the stage and present a token of appreciation to Dr. Randeep Guleria and Shri Subroto Bagchi. With this, I'd like to thank Mr. Raut for doing the honors, and thank you, Shri Bagchi and Dr. Guleria, for sharing such precious experiences with all of us. Thank you so much.